Wait, itching my nose over
Somebody
now.
did this something, Rick?
Okay.
Pretty good.
So the doctors come in what order on Mrs. Corey Green. So I'm going to get Mrs. Green's chart. Okay, and I'm going to get the order. I'm going to go ahead and take that out, so I'm going to need it. I'm going to look on the chart, and it says Corey Green on the order. Her date of birth is 4/5/1972. Penicillin's on the chart, and penicillin's on the order. Okay. I am going to put, grab something else out of here, hang on quick. It's a brain fart today. Okay. I'm looking at the order. I'm just going to go ahead and see why she's here. Bowel obstruction, unresolved nausea, diabetes, hypertension, and heart failure. So that's why she's getting the catheter. She is ordered for a 14 French Foley catheter for surgery. Her bowel obstruction did not resolve. So she's going to surgery. And then there's an order for a measure intake and output every 8 hours. Okay. So I'm going to put a catheter in. I don't know why I've got that there. I'm going to get my supplies, get my catheter kit, and pretty much everything you need is in the kit except the securement device. There is a one size fits none. As Ms. White used to say, sterile gloves. Okay. And they're usually larger. They're kind of clowny like for us with smaller hands. So I usually bring my own sterile gloves in. But this will tell you everything you need in it. But so it should have everything in it. Make sure the package integrity is intact. And I'm going to make sure that it's not expired. And it does not expire until December of the 2021, so that's good. I'm going to look at my gloves. Again, the package integrity is intact. It does not expire until the end of this year, so in December, and that's good. And here's my tape, and my clean gloves are in the room. Okay. So I'm going to get ready to go into the patient's room, grab all my stuff, put that in the bed there. Okay. I'm going to get ready to go in the room. Knock, knock. Hello, it's Kelly, your student nurse. Give me just a second, please. We'll shut the door, pull the curtain for privacy, set my supplies at the nightstand. I'm going to come over and do hand hygiene thoroughly for 60 seconds. Okay, got that done. And after I do that, I'm going to put my gloves on, glove to glove, whatever, put the gloves on, glove to glove, skin to skin. Now I'm going to come to my table. I'm going to get a germicidal wipe. I'm going to go ahead and wipe my table all the way down and on the edge because that's where I'm going to put my tape. Okay. After I'm done with that, I'm going to pull my gloves off, glove to glove, skin to skin, in the trash. I'm going to do my foamy and hand hygiene for 20 seconds. Okay. All right. So I'm just going to wait a little bit on that. Okay. Let's get started. Can you state your, excuse me, your full name? And she says, Mrs. Corey Green. I see Corey Green on the ID band, Corey Green on the MAR. Okay. I see you have allergies. What are you allergic to? She says penicillin. I see that on the band and penicillin on the order. What happens when you take penicillin? I get a rash and have difficulty breathing. Okay. Well, let me ask you, are you allergic to any tape or adhesives? How about betadine? All right. Or shellfish? All right. No. And I just tape. How about water lubricating jelly, possibly? So tape, adhesives, lubrication, and betadine. And she says no to all of them. Okay. Well, let me tell you why I'm here, Mrs. Green. The doctor has ordered an indwelling catheter. Okay. Have you ever had one before? Yes, I've had them when I've had my babies. Okay. Well, you know, it's a catheter. It's a flexible tube. So I'll insert that into your urethra, which is going to go into your bladder. I'm going to inflate a balloon, and it's going to keep that catheter in your bladder. Again, you're going to surgery for your bowel obstruction, so they need to be able to monitor your input and output, and you're going to be in there for a little bit, so they make sure you're not urinating on yourself, but mainly to monitor your input and output during surgery. Okay. I am going to, my brain just left me, hang on. I'm going to use sterile technique with that, so all my supplies are sterile. to create a field and do good stuff. So sterile just means I'm not going to introduce any bacteria, okay? All right. It is a little uncomfortable, but hopefully that discomfort won't last very long. It probably feels more, it's to me, when I've had them, it feels more like you got a UTI, that kind of burning sensation after you pee. So it kind of feels like that, all right? So I told you what we're going to do. So let me ask some history. Have you ever had, or do you have a prolapsed bladder, a prolapsed uterus, a urinary stricture? If they're a gentleman, you want to add, well, they won't have a uterus, but they have a prostate. So do you have enlarged prostate? And I always ask this patient, again, have you ever had a catheter? If they say yes, I ask them, do they ever have any problems getting it in? Do they have trouble getting it in? Okay, so that may give me some clues that I'm going to have some difficulty. And for the guy, I might as well go ahead and get a Coude, okay? All right, so she doesn't have any of that. So that's what I need to do there. So I'm going to finish assessing. Okay, so I'm going to go ahead and raise this bed up. So I'm going to, whoops, sorry, get the wrong buttons as usual. So let me talk to you a little bit while I'm doing this. So it's going to be really important when you get the catheter not to let the bag touch the floor. The bag needs to remain below the bladder at all times. And you're NPO right now, but tomorrow, drink as much after surgery. Well, you can probably drink this afternoon. The doctor will let you have something. Drink plenty of fluids, and water or cranberry juice is the best. Okay, that'll help keep everything flush. And the cranberry juice acidify the urine, which helps with urinary tract infection. Again, bag not on the floor. Bag must remain below bladder at all times. Call to get out of bed. Be real careful not to pull or tug when turning in bed with a catheter. Okay? And let's see. I think of anything else. I can't think of anyone else. Okay. I'm going to, I'm just going to, I don't, but just in case they decide they want, let's just say put on gloves to palpate. I don't want anybody to get counted off. So I would don some clean gloves. And then I'm just going to palpate the bladder. Again, you palpate all over. I'm just palpating by the symphysis pubis. See if I feel a distended bladder. And hers is not distended because she's going to surgery. Okay? And while I'm here, I'm going to just look at the meatus in the perineal area. I am concerned about stuff like warts or a herpes outbreak, because I wouldn't want to get right with me, so I'd be concerned about tracking that in. And I'd also be concerned because sometimes the warts can be really bad and you may have a hard time. They could be like kind of covering like the meatus. So I'm just making sure the skin's intact, no outbreaks of herpes or anything like that, obstruct that. Okay, and she doesn't have any instructions. So I'm going to cover her back up for a second. I want to leave her exposed anytime. So I think I've told her, make sure my brain is all together. Did I tell everything? I did all that. I did all the whys and hows, and I think I taught her everything. Oh no, there is one more thing. During this, Mrs. Green, I'm going to need you to bend your legs, put your feet flat on the bed, and kind of spread your legs. Are you able to do that for me? And she says yes. And once we get started, and I set my field up, I need you to do some rest because then we can break the field. Okay, that's real important. If you can't hold them that long, I'll get some help. Just know, I think I can do it. I can do it. All right. So let's go ahead and get set up. I've done all my teaching. Okay. So what I like to do is I like to use a trash can, and I use one of my third arm, my leg, my foot. Okay. I'm not going to get far from my patient because I got the side roll down. And yes, I would pull this up to my waist level. I'll keep it down so y'all can see better. It's really hard to, so it needs to come, I'll just show you for purposes to see. And then I'll put it back down. So this becomes a little bit challenging for my vertically challenged individuals. I got really one on Tuesday. It's just short, so cute. Let me just double check. So here's my umbilicus, and I'm not necessarily meaning the bed, but like here's the level right here. Okay. So when you get too high, then you're like over the leg. But yeah. So just make sure that you got it kind of, you got it here. Okay. Because if I went all the way up, let's see. It's still, the bed is almost right at my umbilicus, but this is what the level I want it at, okay? All right, I'm gonna put it back down so you can see. Well, maybe. I'm sorry, it's like going on a ride at Six Flags. Up and down, power, power. Okay. I'm gonna put it down so y'all can see better. Okay. All right. So I'm gonna be close. I set my table up parallel to the bed. The reason why, if you turn it like this, and you're donning sterile gloves and your tape, can I see over there? No, I can't see. Can I see that? Kinda. Can I see my sterile field in my glove? Yes. Okay. Many people forget that. I even do a little simulation in the steps. So go ahead and get your table at your, these umbilicus are high, so I'm there. Okay. I've already cleansed the table. Got my trash can. I'm going to get my supplies. Put my order back up here. I'm going to go ahead and do hand hygiene because I want to. Before I open my kit. Okay. 20 seconds. And I'm going to open the outer wrapper. You can use this a couple of ways. I choose to use the trash can, but some people may choose to use this, so let me show you that. Okay, get that out of my way again, so you can use your arm. Some people like to use this as a trash at the end of the bed, so if you do that, you're going to have to pull the covers back anyway on Mrs. Green. Put this here and make a little nest with a bag to hold it up, and you can put it there for the trash. I find it really hard when I'm cleansing to go from here when I'm way high up. It's really hard, so either one is acceptable. I like my trash can. Okay. Okay. So you can use that as a trash. I don't need this paper. All right. And this is going to go on the table. So I'm going to go ahead. All right, Mrs. Green, we're going to go ahead and get you in position, okay? So I need you to let's lift this other. Lift that foot and leg. Put your foot flat. And that foot flat. Okay. Now spread out. I can keep her kind of a little covered here for the moment. And I'm going to take my kit, and the first flap is usually under, and it's usually taped, a little piece of tape. So I'm going to set that with the flat pointing to me. And this is what I tell students where to place the box. If you place it down here and you open up, you're not going to have much of a sterile field. Obviously, you don't want it up here either. So usually what I find is when you put the box, this edge, this back end of it, is kind of put it pretty much lined up with the heels. Okay? That way, when you open it up, you're going to have a nice sterile field in here. Okay? All right. All right, so I'm going to go ahead and I have to put this gown down, okay? I'm sorry. And I'm going to go ahead and if it's taped, put a little, whoops, undo it. Okay.
Do you have gloves on at this point?
Nope.
No. Okay.
Okay. All right. So I'm going to take the first flap and go away from me, and on the side, and it's whichever flap's next, so it happens to be the right. I'm pinching from the back, so no, the back of the kit, yes, this is all sterile, yes. But the back's going to be laying on the bed, which is not sterile. So that's how I remember those sterile techniques. This is not sterile, that's not sterile. So I just pinch from the back and pull that way, okay? Then I come to my left flap and I pinch from the back. Pull down, okay? And then here's my last flap comes towards me. And I don't like this. I know I'm going to see some of this. I check other people out. I don't like the students to reach over here for the tab. My thing is you're unsterile and I think you can touch things. So this is the way what I've been doing. I just pinch from the back. There's no reason to reach over because you're reaching into the sterile field.
Right.
So I just pinch from the back. Okay? Maybe. And pinch like that. Okay? Now see, this has right here, wouldn't be going on my field normally, but see, I got that, and then I got to put the buttock straight and stuff. I'll have a good size. I have a good sterile field. That's why the box placement to me is very important. Okay, so the next part is usually these are the drapes are usually the most challenge for the patients, students. So you see how it's flipped over? It's folded over. The shiny side is the bottom side, so it's kind of So, word, pervious to water, yeah. So shiny side goes down. So the shiny side I see flip. I'm only gonna touch this part, the edge. So I'm gonna pinch that part. I'm gonna pull it out of the field. Be careful not to touch anything that's not sterile. And so I'm gonna, look how much it's folded, okay. Okay. I only want to touch this one edge, and it's not cooperating with me. That 1 inch edge at top, okay? And it is so not unfolding. Okay, that's okay. I'm gonna pinch right there. Okay. We try not to, obviously that, because this is a sterile field, so we don't wanna circulate stuff, so. All right, shiny side, I can touch right up here. This is gonna go, well, that's not what I wanted. Let me do this again. Sorry, my brain is going crazy. I just don't want y'all to get messed up. Okay. So I'm gonna pick it up, backside. Okay. I like to take it, this is like a rectangle to me. I like the longer. No, it's not what I'm doing. Never mind, I've gone crazy. I'm okay. Crazy, just forgive me. So I'm only touching that edge and this edge. I did it right. Okay? So not touch anything. Sterile can only touch sterile. Okay? Then I line myself up by the knees, come my back towards like this of the patient. I can still see my field. I fold my drape in, so the sterile, I'm protecting that. And then I'm gonna, like a bullfighter, I'm gonna lay this down. Now this can't touch the leg, I can't touch the bed. I can touch it here in the sterile field as long as I'm not in the 1 inch border. So I kind of lay it kind of down on the box there. So here I go, and I'm gonna lay it down, and I'm gonna go towards the patient. I don't have to go all the way underneath the buttocks, but just close to it. And my hands come out, ole. All right, so now what's on there, like, oh, it's covering the box. It's okay. There's the one size fits gloves. No, I'm just gonna pinch it. I'm gonna put them over here just in case I need them. And next is the finished threaded drape. I must be sterile, okay? So I'm going to put my finger right there. I'm still close to my patient, okay? Now I'm gonna get my gloves. I'm gonna check package integrity. Open my book. Get the top part down. And then the bottom part down. Open diagonally. I usually kind of do both ends, but sometimes they want to flap on us. Okay. Alright, so usually non-dominant first. Inside the glove, the skin. So I can touch skin in my skin. So skin to skin. I'm going to pick it up with my non-dominant hand at the cuff, pick it up, and step back out of my field because I don't want to cross over. Remember the thumb is kind of out here. It gives you the picture on there. So my thumb's here. There's my thumb. I'm going to, these aren't my favorite pairs of sterile gloves, but I did it okay yesterday. Okay? So you pull it on, and I should not have these long sleeves. I would have pulled these back. Okay? I can only touch the cuff, not the inside of the cuff, not the out. I don't have to mess and have it beautifully like that. I wouldn't mess with it too much because I don't want to make sterile. But that's good enough. So hands, I would suggest that you start kind of here because when y'all start fighting the gloves, I don't know, it's just natural for us to fight down. So the hands can't go below the waist or can't go up my shoulders, okay? So keep them here. Now I'm going to do the non-sterile. I'm going to get my other hand on. I like to hold the package, keep it from slipping, okay? It's a 1 inch border, I can touch that. I just can't, where the seams are, touch that, inside in that, you can't. So hold it, sterile to sterile. I can touch in here. I can touch the fingers because they're sterile. I don't want to touch inside the cup. So just think about that skin. So I like to put my fingers on there and like to slowly kind of get my, these are really, we had to start all over. Okay. What did I start all over? That usually, these are not the best gloves. So I'm kind of holding with some gloves and I put it in the cup and I'm hitchhiking my finger so my finger doesn't touch there. Okay, so hitchhike, step back, and the same thing. Okay, get my hands in there. Sometimes this doesn't go well, and that's all right because now I can touch with sterile. I can touch the fingers. you don't want to touch down here. You can touch your fingers, get your fingers in the right hole. So it works out when I don't do things perfect. I can pull down from here, pull down from there. Right there. Good enough, good enough. Okay. So my gloves are on. Oh, I didn't get my tape. That's okay. Not the end of the world, didn't prepare my tape. Okay, so I move my table again. I'm going to get my trash can over here to my right because I'm going to need it. And this is a good way to hold your hands till you get ready to use them. Is to put them together so you don't naturally touch and kind of put them out. Pray away, not pray to your chest, pray away from your chest. Okay. I gotta make up funny things. All right, so now I can touch the drape. So I can touch anywhere on my fenestrated drape. Again, I'm gonna pick it up. I'm gonna step back. I can touch all around. I don't have to fret with that. And you notice on the buttocks drape, I went longwise, the rectangle way. Longwise, because if you go this way going with it, it tends to flap in on itself. Same thing, this is like a rectangle. In this one, they usually don't have a water resistant side. I do the same thing, long ways. Just think the long, like the long bottom. Because if you go this way, they flap over. So again, pull it out, I'm out. Make sure it doesn't touch anything that's not sterile. Okay, I kind of do the same thing, fold it in towards another. Line up to the knees, and I'm going to get ready to put it on. Again, can't touch the 1 inch border, touch the leg. I'm going to come here, and I can lay it down here, and I go here, and my hands come out towards the head. Okay? And that works beautiful. I guarantee you go the other way, you're going to have problems. Okay, so she's set up there. Now that again, there's the drape that's on top of the box. I can reach in with my sterile hand, keep my other hand out in front of me, and lift it up. I don't like that, so I'm sterile, I can touch that. Again, 1 inch border. There we go. Now I'm going to get my first tray set up. So in here, I'd have my simulated swabs. I would open that. Pull the swabs out. Drop my packaging. If it falls on the floor, I don't care. I'm going to set them in my tray. Next, you got KY jelly. Be careful with my things don't pop out. Okay. Again, you would open this up, and I always have to find a little tear tab. These are not the best ones. Here they are. Okay. I am going to mark that there. Do that. Squirt it in my tray. Again, step back, put it in the trash, okay, and just drop. Again, we want to do this, just drop it, because you don't want to go below your hip waist.
Okay.
If you're going to drop it in the trash, you come out and use that. You don't want to put your hand here. It needs to be 6 to 8 inches above the bag, okay? That's another sterile technique rule. Okay, so I've got that. Next thing in my box is my syringe. So I'm going to take it out. I sit it at the end of my box right here, right now. Now I'm done with the top tray. I'm going to sit it in here. Be careful, don't just sit it on the edge. It's got to be in the sterile field, not on those 1 inch borders. Okay. Next thing I want to do is you're supposed to check the spigot to make sure that it is closed, and mine is closed. It's a round one. It's open and closed. Okay. Next thing I'm going to do is take this sheath off. This is not a fun thing either. So I kind of pull with this hand. As I pull it out, and be careful not to let this, because you don't want this flapping out of your field. To grab my catheter in that hand, okay? Then I take the sheath, and this is a hard sheath to wrap it. Wrap it in my hand like this, and then I take it so it doesn't accordion out and underneath the bag, okay? Miss White does it too. I'll put her video up. Now I want to go ahead and maintain this catheter just like a crazy person. The syringe. Take the cap off, stick it in your box, put the syringe on. Okay? Don't need to test it. Remember? Now I want to bathe. Go ahead and lube my tube real generous here, 1 to 2 inches, guys. Okay? And then we take it and kind of lay it back in the box. Again, you don't want it flapping out. So make sure you get it in a good spot. You can always, if you feel like it needs to be lubed again, you can always lube it later. Okay, so it's not gonna flop on me, okay? So everything's set up, right? Yep. All right. So I'm gonna be ready to cleanse. So this is now gonna become, my non-dominant hand is gonna become contaminated. Cannot go back in the field. So I let Mrs. Green know, I am going to touch you, okay? So you're gonna feel me touching down there. So you're gonna come down and you would spread the labia. Another little point, if maybe your drape wasn't like perfect and it was covering part of it, before you touch the perineum, you can touch in the drape, and I wouldn't maneuver it too much because, you know, the more we manipulate, the more we increase our chances for making stuff. So now I'm going to get the meatus, and I'm going to hold it open. And yes, I know it's very hard on this mannequin. We know that. We're not gonna, you let the labia go back. Do the best you can. It's really hard. I'm gonna have a hard time with my fingers. Okay, so I'm going to cleanse now. Okay, Mrs. Green, it's gonna be cool. I'm gonna get my first swab. I'm gonna cleanse the labia furthest away from me, top to bottom, and put my swab down, out around my head, up towards the head and around the field, and drop. Okay, get my second swab from the top to the bottom, swab down towards the head, around the field, and drop. Okay, one more. And now I go down the center, down, out, and around. Okay, now I'm going to be ready to insert. If I needed a lube one more time, I could do another lube. I like to take the box in the back and sit it a little bit up on the tray because it doesn't pull as much. Not required. Okay, Mrs. Green, I'm getting ready to insert the catheter. So on the count of 3, I'll insert. I need you to bear down like you're going to have a bowel movement or try to urinate, okay? Okay, 1, 2, 3, bear down. I'm going to stick it in, and as I push it in, I walk my hand back. My fingers on my dominant hand cannot touch the meatus. Walk it back. I see urine. How much further do I go?
2 inches.
1 to 2 inches. 1 to 2. You might want to know that. 1 to 2 inches. Okay, so I'll go another 1 to 2 inches. All right. Now I'm going to walk my sterile hand back, back, almost to the Y junction. You can do this 2 ways. If you just want to hold the catheter with your contaminated hand, it says 1 to 2. I would say closer to 2 inches away, so you don't touch anything. You can do that, but you got to be careful that the contaminated does not touch the sterile.
Okay.
I like to do this because it was another instructor when I first started teaching. This way she did it. She did it this way. So this is already walked back. She took the fenestrated drape from the back, okay, here, and she held it then. Just keep it from being dirty, okay? Now, I can reach back here. I'm going to inflate the balloon. I tell the patient, just in case I didn't get it all the way in the bladder, Mrs. Green, if you feel any discomfort, let me know, because they shouldn't feel anything. So I'm going to push the syringe. Now, if I let go, what happens? It slowly starts to fill back up. So hold your plunger all the way down. Okay? It's all the way down. Now I'm gently going to pull, tug on the catheter to see if it's seated. And the vagina's coming out. You're vagina prolapse. Okay. Hope people don't watch this. They go. Okay, so it's seated in the bladder. And see, if I let go of that, okay. So now I'm ready to disconnect my syringe, and I've already got this, so I don't have to contaminate that. I don't want to say on tape, but you got juices from the parotid area. Okay, so I can do that. I'm done with sterile, so I'm going to let that down. I'm just going to drop my syringe in there. Okay, so in the real world, we would tear the fenestrated drape, but so you can have your drape and stuff, and we can use this over. I'm just going to set it there. Now, Mrs. Green, you can lay your legs. You know, one thing I forgot. I should have cleaned, I'll tell you in a minute. We should have had her, I should have had her, I would have missed points on that. I would have got 10 points taken off. That's okay. Make sure she cleans her perineum other than the betadine, like with soap and water. If the patient can do it, we let them clean. If they can't, we'll clean it. And then you want to make sure it's very dry. This is another thing, I don't think I'm weird, but you want it dry, okay? Because it is hard to hold labia when you got lots of stuff down there to spread and you're slipping and sliding. That I've seen students beat sweats. because they're trying to hold the labia because it's so dry. So make sure pat it dry. And I know that sounds funny, but it's true. Okay.
And
So I didn't do that.
in there, then we can tell the patient, can you go ahead and clean your perineum with some soap and
Yes,
water and
give them soap and water.
dry it thoroughly?
And then here, give them a towel just to dry.
Okay.
Yes. Okay. Sorry about that. All right. So I got everything set up. So now, because my hands, I feel they're gross, I like to take off my sterile gloves and put some clean gloves on this point. So I just do glove to glove. It's getting easier than said than done on these things. These things are like, okay. Okay. And I really don't have to wash my hands right now. I just go ahead and put on some clean gloves. I'm just going to pick up and do everything. How you doing, Mrs. Green? How's the pain related to me putting the catheter in? I would just give it a 1. It's just kind of a little mild burning sensation. Okay, that's great. Put my gloves on. Now I'm going to get ready to clean up. So I'm going to take my tray, my box, my fenestrated drape and everything. Bottom drape. Wrap it up. This will just go in the trash. And then that would be there. You go ahead and let her legs like this. I didn't get my tape ready, so I'll have to get it ready now. That's not a big thing. Okay, so go ahead and make your tape. I use like 2-inch tape, but this is all they get for us here. So I do 2 pieces. Okay, and a little larger than, it's probably close to 3-inch. Make my second piece. Okay. And then I do this is another Miss Graham thing. She does courtesy flap, so she folds at the end, so it doesn't stick, and fold at the end. Okay. All right. Now the bag, you want to make sure it comes over the leg. Don't put it in. Well, stay. Okay. Again, you want to give. You don't want that pulling on the manus. So it's kind of hard to do. Okay. All right. So I like to put it and give it plenty of give, kind of right here in the mid thigh, and at the Y port I tape there too. So my bottom piece, my base tape, kind of. Oh, well, I just do it over here. Can y'all see better on this side?
Yeah.
Okay. All right. So put it there. That's a little long, but that's okay. And I get that one, and then kind of do like some of it where it goes together if you can, or you can just do it flat like this. Junction. I hate these catheters. Okay, so it's too secure, plenty of give. Okay, now I'll cover Mrs. Green back up. Okay, so now my bag is, did that yesterday, got twisted up. Okay, make sure your bag's untwisted. It has hooks. You go to the side of the bed. Most beds have a little hook on it or on the bed frame, so it's just like a little square rectangle thing here. So I'm going to put it under there. Y'all can see me not. So it's down there. I'm going to open up my bag. What I want to do as far as, it's a little, yeah, somewhere on the rail. You want to kind of do a little loop, and that little clip is here. So I'm going to move this clip up. So I do a little loop, so it gets that dependent loop. I'm going to clip it here onto the pull sheet. So my loop, and it's going straight down to the gravity. Okay, that's kind of when it looped like that. It'll loop it around, and it'll clip. So it's set there. I asked about her pain. I'm going to look in the bag. I'm going to see how much urine I got. I've got 200 mLs of clear yellow urine. All right, looks good there. Her pain is about a 1, she said. It's secured. I can go ahead. Again, these really aren't that dirty, so I haven't done anything with like body fluid, so I can go ahead and touch her and her linens and stuff if I want to.
Did you leave the perforated sheet?
She said she would have.
Yeah, I would have taken it off,
Oh, okay.
but I didn't rip it because we got to use the tips
Okay,
over
okay.
too. Okay, so she's covered. I'll leave her safe, and as I'm putting her down, this reminder. Now remember, Mrs. Green, if you need to get out of bed for any reason, you're gonna call me. Be careful not to pull or tug on the tube. Pull or tug. to dislodge. Bag needs to be below your waist at all times. And I'm gonna make sure, what, our call light is disappeared. Okay, here is your call light, Mrs. Green, right there. Side rails are up, bed's in low position. I'm gonna go ahead and get her a bedside table and a trash can back. So the bag, well, I'll get that in a minute. Personal belongings are in reach. I'm gonna go ahead and reach up my trash can off the floor. And I've done all my teaching and let her know I'll be back in about 30 minutes to see her, okay? And glove to glove, and skin, and the trash, and hygiene. It's 20 seconds. And she knows I'll be back, get my order, and leave the room. And then I would document the procedure. We go back in, the evaluation, you're just gonna verbalize like we did on MG2. I would go back in, I'd want to make sure, I look at the bag, and I look at the urine bag, so I got approximately 50 mLs additional, so there's 250 mLs, it's still clear yellow urine, okay? Now, if we were emptying catheters, something I didn't say earlier, you're also gonna note the amount and the color, but if you notice any kind of odor, when you, that be a sign of infection, and also looking for the clarity. Urine should be clear. If it starts getting sediment or like stuff floating in it, that's not a good sign, okay? All right. So I got that. I'm gonna ask, how's your pain, Mr. Green, Mrs. Green? She says, oh, I'm not hurting anymore. Then you would also, again, at that point, you would palpate the bladder for distension. Again, pull back the covers and look at the meatus. Make sure the meatus is not any kind of breakdown, any redness or excoriation or any drainage or leakage of urine around the tube. Make sure again the tube's patent. I'm gonna make sure that I still got it looped around and it's got a good drainage, looped to the drainage bag that's draining well. So that's what I'm gonna look at on assessment. Okay. So just additional urine, amount and color, palpate the bladder, assess the meatus for any breakdown, redness, excoriation, whatever, drainage, any leakage of urine, and that my tube is still patent.
When you assess the meatus, are you supposed to be wearing gloves?
Yeah.
Okay. Do we have to verbalize that too, or non gloves?
I'm usually not doing that. I mean, I just tell the students just to say it.
Okay.
And if they take stuff like that, or like I looked at some of y'all, most of them they did pretty good. But like, I think you were one of them was like they whatever, and I gave one of the points back that they took off or something like that. We're just verbalizing. We're not doing all the niceties. We're just, what are you gonna assess? You shouldn't have. Yes, you would put gloves on, but okay. That's okay.
Yes.
Other than the fact that I did not